Hi everybody and welcome. I'm so happy to see you, and that means that you are interested in your health, and that is where I can help you. So today's topic is going to be about headaches. We are going to divide it into sections. We're going to start with some exercises with different kinds of relief therapy you can do, and also massages. So let's get to it, and I'll see you in the first section. Okay, so now to show a few exercises you can do at home. The first one will be to stretch trapezius here. So you kind of lean over and try to pull a little bit with your hand. It's very important to just put a little bit of pressure. Don't yank it, don't pull or anything. Just a little pressure. Hold it for a minute or so, and then let go and do the other side. Also, a very important thing is to do double chin, at least double chin. Looks like this. And you stretch, try to stretch your neck as much as you can. Up like this. Be as tall as you can, as many chins as you can. And it's really helpful for the neck, especially the upper neck, close to the skull where a lot of muscles are located, and they anchor up here on the skull, and you get such a nice relief out of it. So it's very good for that. Another thing you can do is also to use a magic ball, if you have a magic ball. I'll be right back. Okay, so this little thing called a golf ball, it is a huge thing. If you are having trouble with all these kind of things, with the exercises are not quite enough, you are still a little bit sore and you don't know what to do about it, a golf ball, that's the answer. So you take the golf ball, you put it on the muscles. Trapezius is often the big sinner here, and it often is where the biggest area of discomfort is. So try to do that on each side, like this, and just a good amount of pressure, so you know that it's not hurting you, but it's okay that it bites a bit. And then also, of course, you can do it also like on the back, like this. Often use a wall and have the golf ball against the wall, and then kind of just pressure and move up and down yourself. So you move the ball, and close to the spine also is fine, to relieve some of all that tension and discomfort you just have, and it's just a very good thing to do. Also, we can help you with other things here, and I'm going to show you in the next section what we're going to do next. Here we have a very anonymous person that don't want to be in a YouTube video, so she doesn't have a name. Hi, no name.
Hello.
Let's try again.
That was really funny.
Okay, so here we see a lot of tension in the back, upper back here. Trapezius all the way out to the shoulder blade. Very tense. Up here, trapezius again. This is a very big focus area, all the way up in the neck. All the way up here. I can feel some lumps here, so this is definitely a treatment that is necessary. All the way along the spine here. After you heated up the tissue and it's getting softer and more pliable, you can always use your thumb to press even a bit deeper into the muscles and the tissue to make sure that you get into those lumps. All the way here. So what you do is you take your thumb, you put it here on the muscle, and then you try to take the other hand and kind of press it down, press the thumb down, and make a motion like this. This is much more effective than just using your hands, because you apply pressure in a very small area. It's a little bit like the golf ball. Like that. And then you take your thumb again and try to get close to the spine and kind of push the muscles away from the spine. This is very effective also. In order to get to the muscles that are located under the shoulder blade, do like this with the arm, get it up on the back, and you can get your thumb deep into these muscles also. And then on top of the shoulder blade, I hope everybody has seen my gunslinger belt also. For my oil, I use it all the time. Moving up to the neck, an area that is often very sore when having a good headache. Often it manifests up here on the edge of the skull. So make sure that you treat this area with care and ask the patient if it's hurting. Is it hurting?
No.
No. So that's nice. And of course, we duplicate the treatment on the other side. Just gonna go around. And again, try to push the muscles away from the spine, because they tend to contract towards the spine here. Again, often because of computer work or when you're on your phone. This is basically what I want to do on the back. Of course, I would do it for a longer period of time, but for this purpose, I think we are going to show what's going to go on the other side of the patient. So treating the patient with pulsation movements is very effective because it goes deeper into the tissue, and it has a very good effect for this, especially for lumps and knots like I'm feeling here. Here I'm trying to pull the skull. All the muscles that are attached to the skull I'm trying to force into releasing. And of course I will do the same treatment on the other side of the head. Okay, and don't forget to subscribe, hit that like button, and also the bell if you want to have notifications when I post the next video. See you then. Peace.
Oh, remember to subscribe. Everyone have an ice cream now?